Okay, so I'm starting my integration videos for my patient, Jamie Carson. He's an 18-year-old male with 24-hour history of some right-sided abdominal pain. He came into the ER where he was diagnosed with appendicitis, and he's been admitted to the floor. I'm gonna be his nurse, and we know he's gonna go down for an appendectomy at 1500 o'clock, which is 3 o'clock. So I'm gonna go ahead and start with my pre-op assessment, and then in my next video, I'll be doing all of my other skills. So to start out, first I'm gonna introduce myself to my patient. Hi, I'm Asia, I'm gonna be your nurse today, and I would identify my patient at this time. I'm going to check my patient's arm bracelet. I'm gonna show you his arm bracelet. His identification bracelet. And he's able to speak, so I'm just gonna have him verbalize to me his name as well as I match it with his arm bracelet and my doctor's orders and my MAR. So he's telling me that his name is Jamie Carson, that he's 18 years old, he's a male. I'm gonna ask him, if he knows where he is. He's alert and oriented, so he's able to tell me that he's in the hospital right now. I'm gonna ask him who the president is. He's able to tell me that the president is Donald Trump. And I can ask him what year we're in. We're in 2020. So I know that he's alert and oriented ×4. That's something that I would document at the end of my assessment. At this point, I can go ahead and grab some vital signs from my patient, which I've gotten. He's got a blood pressure of 140/80. His pulse is 80. He's got a respiratory rate of 18. His temperature is 99.2. He's got an O2 sat of 98%. I'm also gonna go ahead and do his AccuCheck because I know my patient is a diabetic. He's got an AccuCheck of 250, so I know that I'm gonna be having to give him insulin prior to him going down to the OR. I would also assess my patient, asking him if he has any allergies. He states that he has no known allergies, and if he does have allergies, he doesn't know about them. So he's got no allergies at this point. As I'm doing the assessment, I've assessed his alert and orientation already, but I'm also going to be assessing his skin, making sure he has no breakdowns, no lesions, no molds, anything of that nature. Once I get that done, I can go ahead and also assess my patient's pain using the OPQRS-T scale. So he states that his pain is at a level 9 of 10, so I know that I'm going to be needing to medicate him for pain. Starting with the O, I'm going to go ahead and ask him the onset. When did his pain begin? And already in his in the notes that I have already, I know that it began 24 hours ago. He's been having this pain for about 24 hours. Moving on to the P, the provocation, anything that makes it better or worse. He states that movement makes it worse. When he eats, it makes it worse, so he hasn't been able to eat much. Movement, any exercises, anything of that nature makes it worse. He states that anything that makes it better, he's been taking Tylenol at home to try to help the pain. It hasn't helped much. The Tylenol doesn't really help, but he does state that sometimes he takes and sits in a warm bath. That has helped him at home. Q, the quality. What does the pain feel like? He states that the pain feels like sharp pains. They're sharp pains. They're constant sharp pains that he's been feeling for the past 24 hours. Q. R, the region. Where does it hurt? So I'm going to have my patient point to me where it hurts. He's pointing to his right lower quadrant. So that's how I know. That's another way to confirm that he's experiencing some appendicitis here. S, the severity. How bad is the pain? He's already stated to me that his pain is a level 9 out of 10. So I know that his pain is pretty high. So I'm going to medicate him for pain. And then T, the time. When did the symptoms begin? Is there a time where it hurts more than usual, where it feels better than usual? He states that the time it's been the last 24 hours, and it just is a constant pain, so it's always bothering him, and it has been since it started. After I go ahead and do that, I can assess my patient, his height and his weight. So I'm going to measure his height. He's 6'2". His weight, he's 189 pounds. We use that because a lot of times pain medications are administered based on the patient's height and their weight. We don't want to give them too much or too less, being if their weight scales are off. I would ask him if he smokes at all, if he drinks, does he take any recreational drugs, of which he states he does not do any of the sorts. The consents were already signed down in the ER. That's something I would make sure to have with my pre-op checklist. I've got my patient's consents. He signed them here. The consent was signed prior to receiving any pain medication downstairs in the ER, and that is on his chart. I would go over his H&P. He states that he only has a history of a little bit of hypertension. Other than that, he has no other medical history. If he has any prosthetics, if he has any implants, that would include any like a prosthetic arm, a leg, if he has a pacemaker, any extremity, or any implant of any sort. This will be the time he'd tell me, of which he doesn't have any. We would go ahead and get a CHG bath because he's 18 years old. He's pretty self-care, he's independent, and he can give himself a bath and doesn't need, me to give him a complete bath. So I would go ahead and give him the chlorhexidine soap so he can go ahead and get the bath ready to prep him for surgery. Once that's done, I would ask my patient if he has any glasses, any dentures, any hearing aids that he has, and if so, things that he's not going to need, such as like the dentures, if he could leave them with a family member, or if he wants me to call security and lock them up in the safe. But his glasses and his hearing aids, he would be able to keep on just until he gets down to the OR, just in case the doctor needs to speak to him so he can know what's going on once he makes it to the OR. But again, my patient's only 18 years old, so he doesn't have any of those. I know my consents are signed. I've done my pain assessment, and then I can go ahead and do just an abdominal assessment. I'm going to go ahead and auscultate, and then I'm going to palpate and perform my abdominal assessment on my patient. So I'm going to go ahead and do that. I'm going to auscultate with abdominal. You always auscultate before you palpate. And I'm going to actually auscultate starting in the right lower quadrant where he states his pain is the most. So I'm going to go ahead and start there. And I'm going to go ahead and go clockwise. I'm listening to each quadrant for about a minute unless I don't hear any bowel sounds. Bowel signs, I'll hear them. They're pretty hypoactive. Okay, so now that I've auscultated my patient's bowel sounds, I can go ahead and palpate. I'm going to palpate starting in the left lower quadrant where it's least painful. So I'm going to, you can pretend that he's lying down now. And it feels a little tender. I'm going in I've separated my abdomen in 4 equal quadrants. Okay, and his abdomen feels pretty tender. And at this point, I will go ahead and proceed to my next video where I do my pre-op checklist. Thank you.